Hello, my name is Maureen Macbeth. I'm here tonight at the NLN to talk to you about something really important to me, shared decision making and how we can transform care for lymphedema. I'd like to thank Tactile Medical for giving me this time to follow up on 2 other webinars we did earlier this year. So I'm going to get a little more comfortable though, and since I'm safely in a treatment room by myself, I'm removing my face shield. I'm still in the clinic, so I am going to keep my mask on. It's important that we understand that as much as I want to spread the word about lymphedema, what has really changed is just, the safety considerations we're having to take that are affecting not only our professional but personal lives. So I want to talk a little bit about why we actually created this document that you're going to have access to at the end of this little talk. And it really has to do with what we talked about at the first 2 webinars. Right as the pandemic was really gathering momentum and things were in major shutdown, Tactile gave me the opportunity to create a webinar, and we called it The Time Is Now, an urgent need for surveillance and early intervention for cancer-related lymphedema. And it's been really important because we know now, a couple months later, that there really have been some gaps. So it was in June when we decided we needed to follow up on that April webinar and got together a panel of esteemed colleagues who really sat down. We actually did an exercise together. And that exercise helped us really think about the changes that we were already having to make. And some of them were, forced by the virus, right? But it really made us sit back and reflect upon what we've been doing. And so now this next little step we're taking is trying to give some tools out there for people to use. So voila, here's the tool we've created, and you'll have copies of this. And we said, what is it that we can do? And some of the things we identified during that first and second webinar were that we need everyone, whether the referring provider, the patient, or the therapist, we need to commit to these 3 ideals. One is being informed. And then the second one is utilizing resources, and the third is bridging the gap. Now, this document is not comprehensive, but it's just a jumping off point, and you'll be able to adapt it as needed for your clinic. So one of the things I really like is that we put one of the definitions for what shared decision making is right on the top of the page. And for many patients, this is a new concept. They've not really heard someone formalize it, and they don't really understand that, this is what all their clinicians should be trying to do with them. So that's the first way to start to use it. The second thing is we have a section for both referring providers, patients, and therapists about being informed. And an example of, how you can work with your referring providers is make sure they have a list of the other CLTs in the area. I have some situations where I don't take everyone's insurance, and I need to call back my referring provider and say, hey, I'm sending them down the street to this other colleague who's really trusted. We have to make sure that, they understand the referral process for their patients. There's nothing more, frustrating than a patient drives an hour to my clinic and they don't have the right referral. And that's where my ability to work with my team to knock out any barriers ahead of time is one of the reasons we started doing a quick triage phone consult with our patients to really make sure I'm the right place for them to see, and there's not some other things we didn't consider before they came to see me. And then whether it's the referring provider or myself, letting the patient understand what to expect when they get here, how important it is, that the patient, they've driven a little ways, they go to the ladies' room beforehand, they wear easy to get off clothing, things like that. And a lot of patients, if that's not described to them ahead of time, do run into problems. And so in terms of utilizing resources, there are a couple things, especially with providers. I've had so many of them when I've reached out because of having more time on the phone since COVID and explained to their office the process of letter of medical necessities. It's really helping speed that up. And then I'm going to be using this resource list to send it out to my offices. This is really one of the things that made me create it, is because I had people saying, hey, Is there something you can give us to give to the patients? So for the patients, again, the resource list will be able to have them even have some questions before they get in. And we're often really checking if someone needs help. Our policy in the clinic is that they can bring their second set of hands in. They just have to go through all the same screening. But I found, there's no other way to treat lymphedema. If I have a patient who can't reach their feet, their caregiver needs to come in. So we're making that happen. And finally, as a therapist, we're doing a lot of the upfront benefit checks, even talking to the patient about reaching out to the DME first to really find out what we're dealing with before they come all the way in. And we're trying to, again, mitigate some of those problems before we even get started with care. And right now we have to, because every time a patient comes out, they're at risk, their health is at risk. So we don't want to have visits that aren't meaningful. So our last idea was about bridging the gap. And I'm going to actually start with the therapist this time, because I think we found we have to get, like I was saying in the last slide about utilizing those resources, we need to think about self-management, home management from day one at this point. And it's really almost starting before they come in. And we also are setting up really that 1 to 2 week almost trial of therapy. We're saying right now, if we don't see it working during that time, then we have to reassess maybe some barriers to care that we didn't anticipate and take a step back and maybe take a break. That's happened in a couple of cases where patients just weren't able to get transportation, or I've had people where they've had to, someone in the family got sick. I had a patient, her daughter ended up with COVID, so the whole household went on lockdown, and we just have to deal with that and find ways around that. In terms of for the patient, though, right from the get-go, and even this is where that phone triage I often do with them, is I talk to them about they're actually going to be the ones that are going to be doing their treatment, and that it's really incumbent upon them to tell me when things aren't working. I'm never going to be upset. It's about how to figure it out for them. And so with that, with my referring providers, again, everyone's a little more used to the phone calls now and the televisits. We've also talked to our providers about making sure we have like a cell phone, and I'm talking sometimes their personal cell phone. We've had a couple situations where there have been emergent issues, and because of the offices not being open the same way, we had some delays, and so it made for some tenuous situations. So really talk to them that you're not gonna, abuse that, but it's a very important thing. And again, we're trying to work more closely together, and we hope that you can utilize this tool. If anyone wants to adjust it or make changes and reach out to me, I'd love to hear from you. And that's really what this is about. So this is the resource guide, and this is the other thing that can be handed out. And you can see it starts really with not only just having stages of lymphedema. We just use the ISL stages here, and then we have some of the major organizations, obviously the NLN right there at the top. And it's so important so the patients really know where trusted information is online. And then we took this kind of barriers to care checklist, and these are a lot of issues that you may need to make sure you're dealing with before someone even gets started. Then finally, we just have a little bit of lymphedema lingo, and you can see, look, this may not be perfect, but it's just got some of the basic, especially the acronyms we use all the time. I can't, if I had a nickel for every time a patient's like, hold on, what's MLD again? And this is all new to them. So just having this out is a little helpful. So again, want to thank you and want to thank Tactile for just taking this time. We're going to open it up to questions in a minute. But first, I just wanted to put these two screenshots up here. These were from when we had our panel together. And I loved some of these quotes that came out from our work that we did. And, one of them, I think, was from Linda Hodgkins up in Connecticut. And it just said, observe more, listen more, slow down, and allow patients to find routine in their new diagnosis. I can't emphasize how important that is. And we hope, that these little guides that you're going to be able to get off of Tactile's website, print out as many as you want. There's no copyright on them. It doesn't have Tactile stuff on it. It's just something I created based on the work we've already done. And like I said, reach out to me. But right now, we're going to be live and take some of your questions. Thank you so much.